Folks, thanks for coming on with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing the programs made available through the Medicare Advantage program of dual special needs plans. And we'll speak to how you can identify the programs that are active in your area and start to create a marketing program to help make them a viable part of your overall marketing plan. A bit of housekeeping before we start. You'll notice in the software they have a point in there, a section for set questions. If you would, please enter your questions in that area. Generally, we answer all the questions by the end of the webinar, but today's webinar is being recorded, and it and the presentation and some of the material we reference throughout the course of the presentation, including any questions we have to reference or research. I don't think there'll be any, but just in case, they will come as part of the follow-up to everyone who has RSVP'd to today's meeting, where that will come to you in an email. I would ask you to watch your spam filters because I do send a number of attachments, and sometimes on a mass sent blind copied email, that'll wind up in your spam folder every now and then. So my apologies for that, but we haven't got a way to get everything to you in a neat package yet. A bit of background about our organization in case you don't know. Premier Marketing is a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler offering insurance services through independent agents such as yourself to the general public. Those contracts we offer those programs at are at the highest possible commission levels and generally available to anyone who qualifies, or also recruiting contracts for those that are looking for that assistance. One of the things you'll note is I mentioned we started our organization in 1968, so that means recently we celebrated a milestone in our history, our 50th anniversary, which is what I consider quite an accomplishment for what began as a small family organization in rural Nebraska that's grown into one of the largest organizations of its type with experience in all lines of Medicare product. We offer a full portfolio of products as well, including all of the Medicare Advantage programs, the Medicare Advantage, Med Sup, and PDP programs, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need programs, long and short-term care. We also offer disability income programs and ancillary programs, those that offer benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs as well. In that Medicare Advantage portfolio, you'll notice all the national carriers and many of the strong regional carriers that can make a difference for you in your chosen market. You'll find that many of these carriers are the ones that also have a lot of experience in the dual special needs programs. That PDP program offering echoes the same type of philosophy as put into the Medicare Advantage programs, where all the national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust and has different programs that help you be successful in that space as well. A little bit of a different topic in many circumstances than discussing programs with the dual population. In the ancillary space, you'll notice in each of the categories, the national leaders in that product type are available for you. Those are excellent prospecting tools. They're also excellent ways of helping drive higher persistence in our line of business, within our book of business for our organizations. More product you have in a household, the better your retaining of those products percentages are. And we'll note as well that they come with their own stream of income. I can make that dramatic enough. When we look at the Medicare market overall, we're looking at a program that when you come to a presentation such as this, you'll hear the baby boomers aging into the market, 10,000 a month, the silver tsunami, the turning of folks 65 every 10 seconds. Well, if we look at Medicare purely on a numbers basis, this would come as close as we could identify to start, but you'll find that many people, when they hit 65, continue to work, so they don't all go into the program all at the same time. And we'll find as well that about a sixth of the Medicare population are actually under the age of 65 and are great prospects for the programs that we offer. So that's something we need to consider, because it is a very diverse population, one with a lot of chronic conditions that come into play, and sometimes limited income and assets as well. We see a environment that is open to the programs that we offer, and also one that really needs the assistance of the help that we have in this space. So it gives us an opportunity to help a number of people grow our prospect pool, grow our number of sales throughout the year, and positively impact folks throughout the age and income spectrum. It gives us an opportunity for those folks at the halfway part. Well, we've got something for them when it goes down in income and assets. We also have programs that help them on the way up over that median income as well. Because when folks get on Medicare, they have a number of choices to make. One, do they want to take all of Medicare that's offered to them? Are they going to take the elective Part B? Are they going to sign up for the Part D programs at the bare minimum? Are they also then going to pick up a program that allows them to stay within original Medicare and still get some assistance with those medical costs through a standardized, modernized Medicare Supplement plan? Or are they going to take the route that goes into Medicare Part C, that most often as not, plans offered by private insurers that incorporate A and B and D and extra benefits into programs as well? That's where we find our space that we discussed today with the dual special needs programs. Because we'll see, as people age into Medicare, and you'll notice I should take and rephrase that, because it's not just age-ins, it's the people that are accepting Medicare at a later date than 65, so their first entree into Medicare. We see them making some pretty even choices when it comes to Medicare Advantage versus Medicare Supplement plans. It's not a true indicator for our population today in the fact that Medicare Advantage plans include the SNP plans, and you might have a portion of the population that have a MedSup and have some sort of assistance and aren't aware of it, or in a pickle in a different fashion that might best be explained to them. But there are also some folks that stay in what's termed as original Medicare, because that's where you'll see some of the folks that have just Medicare and Medicaid fall. So when we discuss it again, we'll see that those folks that are under the age of 65 are not only great prospects for our Medicare programs, but also you'll note that a good portion of them have both Medicare and Medicaid, and that a good portion of them, in many circumstances, don't have supplemental coverage, and hence have a real need for our program. Because they're a well-rounded group of individuals throughout the country, and our next task basically is to learn more about the programs themselves and where these folks are located, and that's what we'll do. Medicare, however, if you're just entering into the area, or if you haven't dealt with Medicare Advantage programs much, we do have a translation guide for you from CMS or from the Medicare Learning Network that gives you the answer to what is AAA in CMS. Well, it's an abdominal aortic aneurysm. I knew that. Sure I did. Anyway, so these are available to you as part of the follow-up to today's presentation as well. When we look at marketing dual special needs programs, we have to be aware of the fact that they also have the timetable that comes into play as to when a person can enroll. Up until recently, it was anytime, month to month. There have been some changes brought about as of last year, moving into 2019, that took the Medicare special needs programs and other SNP, SEP opportunities and change some of the timing of some of them. But mostly, the base coverages stay in play for you, where the annual election period is from the 15th of October to January 1st, and then the non-renewal period at the end of the year, and OEP in the first 3 months of the year. We've got some different things that come into play then with those special election periods. There are some programs around the country that are 5-star and rated 5-star and eligible for this step period. We actually have a webinar on that later this month, to watch for it. But there are a number of other special election periods, and many of them center around folks who have some challenges with their income and their assets. This is the special election period that I mentioned before. It used to be each and every month. Now it's one special election period per quarter. It's available then to change that coverage at the first of the month after the request is made, but it cannot be made for at-risk or potentially at-risk beneficiaries. What's that mean? Well, that's part of why this step period was cut into a few different pieces, because outside of what we see as some of the more standard special election periods, we still have a number of programs addressing those folks that have challenges with income and assets. You also have the special election period that just ended recently for Hurricane Dorian, but we also then have the Medicare COVID-19 according to FEMA resolutions as to how we can use that moving forward. For folks that didn't exercise an OEP, that's an option to them, but there are greater details we need to get to you on that. Going back to the little bit of teaser we put in saying, well, the LIS and SEP, LIS and MSP, SEP got chopped up. Well, to a degree, after the 1st of January in 2019, those monthly SEPs now become quarterly for the first 3 quarters, with the last quarter satisfied by the annual open enrollment opportunity. And we then see that these folks have the potentially at-risk or at-risk individuals, and this is a way for the government to monitor some of their frequently abused drugs that will not be able to have the duals and the special election period for LIS available to those individuals. So we have a little bit of a change in that area. We want to make certain that we follow up on certain challenges with different medications in our community. So when we go to some of this, it gives us then the opportunity for those people that always say, well, I didn't know that I was enrolled in that program. So this gives those folks an opportunity to exercise an SEP as well. So when we look at working SNPs, special needs plans, let's talk a little bit about the history. These programs have been around since 2003, brought into existence by the Medicare Modernization Act, and then renewed or reinforced with different pieces of legislation throughout the year, including some things that we most recognize as insurance agents for changes in Medicare supplements, with some of the extension brought about by that legislation, MACRA, for special needs programs. These plans are a specific type of Medicare Advantage program. They generally have a set network, and they generally limit their membership to people with specific diseases or characteristics, and they tailor the benefits, the provider choices, and the drug formularies, those list of covered drugs, to best meet the specific needs of the groups they serve. This is an area where we've seen much more of carriers exercising the non-medical benefits that have been cleared for their use over the last couple of years as well. And we see them most commonly occur in these special needs plans. And there are 3 types of special needs plans. There's the chronic special needs program, what we discussed in an earlier webinar. It has a number of health conditions where if a person has one of those conditions, they may be eligible for one of these types of plans, but a plan has to be in that service area for that person to be eligible for it. So you'll notice some challenges with that, and there are, just because a physical condition is listed that doesn't meet a plan is necessarily available. Those are just the plan options with different health types. Where we normally see these programs available, the health conditions that come with them have something to do with the heart or cardiovascular system, diabetes, and then pulmonary conditions as well. You get beyond that, you don't see the programs quite as often. With some of the changes being brought about for 2021 and ESRD currently being covered as, very limited fashion, I may add, in some service areas, it will be interesting to see how that would be modeled in out of a SNP plan perhaps, or make it available more readily in a SNP plan with greater changes in the other benefits. So you have the SNP program for folks with chronic conditions. You also have the institutional SNP, which is available for folks who live in a certain institution like a nursing home, or they require nursing care at home. The number of these programs have been limited, and in the past, we've seen them offered very rarely through the broker channel, normally through captive agents or employed agents. We do see that the third type of SNP plan, which is what we're discussing today, is a dual eligible SNP, and this is available to people who have both Medicare and Medicaid, commonly referred to as a dual beneficiary, a dually. To enroll in a dual SNP, the consumer must be entitled to Part A and enrolled in Part B. They've got to qualify for Medicaid assistance, normally at a level of QMB or lower to fully access all of the benefits. They need to reside in the service area, and this year still, they must not have end-stage renal disease to qualify the program. There are some exceptions, as I mentioned, with some of the SNP programs. Because SNP programs must include prescription drug benefit coverage, Part D comes as part of this program. It also includes other ancillary benefits according to plan type that vary outside of some of the just normal health condition coverages. And we'll see that as we get into a specific example in a little bit. Once again, that SNP is available once a quarter, and the coverage begins the first of the month after an application is submitted. This then gives us another view at the variations of the eligibility and how we must be aware of the fact that some people may be potentially at risk or at risk for the misuse of frequently abused drugs, and they won't be able to change. This is why it's so important for us that as we make a change or a choice as to what carriers we work with, it's important to have those that have the support that's able to tell us, well, this is a true dual or extra help individual, but they're not eligible for this SEP because of the at-risk or potentially at-risk designation they have. The majority of the big carriers have those as part of their agent support, and it gives us a great amount of confidence to submit an application knowing that the special election period has been verified for us, and we don't have to re-explain everything to our prospects and clients regarding why they can change now. So it gives us, once again, a variation between the SEP itself. When we look at this as a commissionable opportunity and we bring into account more than just the folks that are eligible because of chronic illness and that SEP and that SNP, and also the aging of the baby boomers, we have that population of the dual eligible beneficiaries that represent 20% of the population nationwide. We take a look at the number of people who are on Medicare, 58 to 60 million. Let's round it up to 60 million. 20% of that, you've got 12 million people across the country eligible for a product that is not nearly as deeply penetrated as the other programs. And why are we confident in speaking of dual plans all the time? Well, it seems to be the wave of the future. Well, we also see that from 19 to 2020, there was an increase in 19% in the number of dual plans available. It doesn't take into account necessarily the same dual plan growing that service space, which has happened, and we're seeing a lot more carriers be a lot more active in the offerings they have with dual programs. So if you look at the categories, the vast majority of the SNP programs out there are dual eligible SNPs. So we know that we have a large market that we need to go with. We also know that the dual program people normally want the agent to visit with them and be comfortable with that space. So your role is once again reinforced with the need to speak to a real person in many circumstances. And we're going to see a lot of catch up to a degree as we come out of social distancing and the challenges that we've had with COVID. We'll still want to exercise the right way of doing things there, obviously, but there'll be a kind of a backlog of people who want to speak. And that's part of what we need to do. We need to be aware of, too, what is the difference between a Medicaid individual and a person who is on Medicare only. And we'll see that the differences for counting income and assets can vary from state to state, from group to group. So when we speak of Medicaid for someone who's going into a nursing home and assigning their Medicare to that facility, we're speaking of a different level of program than what is eligible to folks that we refer to as community-based. That's something we need to keep in mind before we begin, because a lot of what we're talking about in our part of the world are termed or named Medicare savings programs and not Medicaid. And the way that some of the health care is delivered under that Medicaid program for that state may confuse the individual that you're working with even further. MSPs are Medicaid administered programs, and they help cover benefits, some of the benefits that are shortfalls in the Medicare program, such as premium and cost sharing for those with Medicaid, and they don't qualify for full assistance. You might see these as well. It's a horse with different colored lipstick in many circumstances, because some of these same programs are named one thing in one state and one thing in another. So if you are working multiple states, it's important for you to have your homework done as to what do they call Medicare in this state? Are there some specifics that are different for their eligibility to become a beneficiary of this program in the state that they're moving here? So some different things that can come into play. There are 3 types of coverage that we see as MSP individuals more commonly than others. There's a fourth one we'll refer to. Don't see it too often. The first one is a qualified Medicare beneficiary, a QMB. This program pays the Part A premium, if applicable, and the Part B premium, and any penalties that there might be on the Part B premium as well. It also pays the Part A and B deductibles, co-payments, and or co-insurance. It's a pretty healthy benefit. The specified low-income beneficiary, the SLMB, this is a program where the beneficiary pays, it pays the Part B premium of the beneficiary should there be one, or any penalty as well. The qualified individual, the QI1, is much like the SLMB, a higher a higher income tax or test, but it covers the Part B premium as well. A little bit of history on the program. We'll see that even though we've got a program here that is over 30 years old, the majority of the people that are eligible for it aren't enrolled in it. That's the QMB program. And that's the program that in most circumstances is the minimum amount of coverage a Medicare Advantage carrier wants in order to make their DSNP program work. There are exceptions to that, and we'll talk about that. The SLMB program was enacted 2 years later by Congress, with the QI1 program brought into existence by the Balanced Budget Act in '97. So we see a 10-year difference between the first of these types of programs with the Quimby to the qualified individual one. And what we have here then is a level of income and an amount of assets that must be met in order for a person applying for these programs to get this assistance. The QMB, well, these are the folks that have income less than 100% of the federal poverty level and resources that are below $9,860 if single, $11,800 if married. This then gives that beneficiary, and it's an individual designation, so a husband and wife have to apply separately. It then grants that individual the Medicare premiums, as we discussed, Part A if applicable, Part B, the deductibles, co-insurance, and co-payments of the program as well. This is for the 48 continental states. States of Hawaii and Alaska have a higher income check on it. So the number for a person to qualify for this is $1,083 as a single person, $1,457 if married. Excuse me. SLIMBs, this is a program that helps people with incomes between 100 and 120% of the federal poverty level with the same assets test that we had on the Quimby program. But what this does is cover the Part B premiums without the penalties, and covers the penalties as well. So you've got a income test here of right around slightly under $1,300 for the single individual, $1,744 for a couple. In Alaska and Hawaii, those numbers are obviously higher and different. When we look at QI1, this does much of what we discussed with the SLIMBY program, but it goes up to 135% of federal poverty level with those same assets test. So you have many more people have the opportunity to get their Part B premium subsidized under this program. And you'll see that at 135% of federal poverty level, the income test is at $1,456 and at $1,960 for single individual. Those numbers are higher once again in Alaska and Hawaii. When we look at then, this is the QI1 coverage. I didn't highlight it the same way because we don't see it nearly as often, but we'll fix that before we send it. This is for the individual who's an adult under 65 and disabled, but who recently returned to work and is no longer eligible for Part A premium free through the Qualified Disabled Working Individual Program. So it's got income that's different. That's 200% of federal poverty level, so it's basically 2 times Quimby's. And the assets test is more like what you see into older programs in the MSP history or some of the other assistance programs that may be out there. So an individual here has a limit of 4,338 as a single person, much higher as an individual. And once again, those amounts vary for Alaska and Hawaii. Once again, to be eligible for a dual SNP program, the individual must have Medicare Part A, be eligible for Part B, pass and meet those income and resource tests that we just went through, and keep in mind the incomes are all the same in the continental United States. 2 differences for Alaska and Hawaii, and the assets test are the same across the states, except for states who have chosen not to require an assets test. That's why there's a caveat here where 8 states, Alabama, Arizona, Connecticut, Delaware, Mississippi, New York, Oregon, and Vermont, and the District of Columbia have decided not to have an income test. That is an interesting quandary for you that might have an individual moving into a state that has an assets test that didn't before, because they may well qualify for their assistance under the old program and their old residence, but not in the new one. These applications can be submitted through the local Medicaid agency, normally housed in the Social Security offices, which we should see opening up here very, very soon. Or they can also start the application process for MSP by completing the low income subsidy on that, and it will kick it in through the system automatically. Pardon me, searching for that word. Eligibility is generally redetermined each and every year. What we need to be aware of as well is in these states, there's also programs, pilot programs, they still refer to them even though they've been in existence for a while, that are Medicare, Medicaid programs where the federal and state government offer a singular program. So it's not a Medi-Medi, it's not a dually, it's a different type of program. Pardon me. And they are available in these states. It affects how we market. We're using Texas as an example because I have the material and I'm in Texas. But this program, you'll see that in the 254 counties in the state of Texas, it is only a requirement in 6 of those counties. But as you'll see, they're the largest 6 counties in population in the state. It doesn't affect every beneficiary in that market. If that individual has a Medicaid carrier that's different than the one that is listed here. So some different things come into play as to how this comes to bear as in who is in these programs or not. Once again, it's a challenge for those states that are in these marketing programs because in Texas, it's in Texas now, it's in you have a dual SNP available in every state, and what you can sell then can be very much influenced by who handles the managed Medicaid product. So it's important for us to have a vehicle that we can use to get into these programs and find out, well, gee, what is there? Plan Finder will do that for us. It gives us an opportunity to find the most recent plans that are available. We can find this information without creating a account, simply by logging in to see what the information will be. And it gives us then opportunity to dictate our choices. Since we're looking to see which dual special needs plan is available, we're going to want to look for a Medicare Advantage program, and we're going to want to see if it's including the types of SNP programs we want to look at. In this particular circumstance, of course, we're looking for people with both Medicare and Medicaid. Clicking on that box will give us an opportunity to walk through it. When I did the example, I was using this for chronic SNP, and it pulled up a listing of the program and detailed it for us, where it says that United Healthcare's Medicare Silver program is a C-SNP program. We go to that website, pardon me really quickly. It'll give us an idea, a quick run through as to how we find it. Pardon me. Well, that's not what I wanted. I'm making this look a lot more difficult than it is, don't I? This is going to tell us how to log in and create an account with Medicare. There's generally, pardon me, the point that gives us, there we go. I just log down, and there's our 2020 plans, just as it is in the example. And to continue without following in, creating an account, getting into Medicare Advantage programs, it's asking us what zip code. Choose the one I live in. Counties. You get help for these costs for one of your programs. I'm going to use this. And skip that because we're just looking at what plans are there. Obviously, you're doing a search, you're going to want to use it. So 38 plans. See much of a difference without the drugs laid in there, but you'll see that by adding the dual special needs programs, we've added 12 plans to this opportunity. And we'll see that in Denton County, Texas. Humana has a program available there. 2, 3. Allwell Centene has a program there. WellCare has a program there. 2, 3, 4. United Healthcare has a plan there. Everyone's flying by it, but it does say DSNP. They didn't count like Blue Cross because it doesn't say that, or Care and Care hasn't started. There's an MSA available in the area. So we'll see that here's an Anthem program available to a DSNP program. And it then describes the different pieces that are available to us as part of that program. Does it describe it in full detail that someone can make a good choice off of this? Not in my opinion, but it gives us what we need, an example of the different plans that are there. The 5 DSNPs, some available there. One of the things that we can see as to why we feel these programs are going to be around for a while is the fact there's been a 19%, well, there was a 19% growth year over year for the last 2 years of carriers offering additional DSNP programs year over year. So when you know these plans are going to be there, this is also a way for us to find out additional information. Q1 has a great sheet with information on it. Pardon me. That gives you more information on the MMP plan, the dual program that we discussed, some things that are going to come to you as part of the follow-up to the day's presentation. This gives us more information on where those plans are and the numbers that are involved with these programs. You'll find very often that there may be a difference in network between a regular MA plan and perhaps a SNP plan of some sort. You'll see more variance there, availability in the DSNP world than you would any other, because an iSNP, their network is the facility itself. So it's a different animal you're looking at there all the time. So it's a different world with different amounts of assistance available depending upon the plan types you get. But we can lay it out. And then we have then the beginning of a discussion in our mind as to, okay, these programs look pretty interesting. What kind of help am I going to get on explaining them properly? And what else do I need to know about offering these programs? Well, one of the things you need to be aware of is this is an area that you really need to know the plan network outside of, boy, I got to do it for compliance sake. No, I asked them for this. What do I need to do? You need to take it beyond the discussion of a doctor and a specialist and maybe a hospital, because the DME carrier and the home health care individuals and the people that offer programs that a lot of folks think, well, that's not really Medicare. Well, yeah, it is, and they're the same type of people that can keep you from having a stable book of business in this area. It's important to know those assistance plans. That's why those publications from the National Council on Aging on the income and assets test for the different levels of assistance for both MSP, and LIS programs will come to you as part of the follow-up. You got to have those numbers at your fingertips. And there may be times that for a particular individual, not being able to qualify for a dual SNP doesn't mean they don't have an option to look at other coverages because of another SEP that may be available to them. Well, they just got LIS or they have it. That counts. And then what other type of regular MA plans are available in that area that could be a significant fit. It's also important to note that you need to be prepared for a bit of a longer appointment because you may have to repeat certain things, and there may be other parties that are available or that are in on the overall decision as to is this what we're going to do. And in many circumstances, that may be a preacher or a family member. And keep in mind that not taking this step is one of the ways to have that multiple step work both ways for you, where you not only are able to use it to enroll somebody, someone else is able to enroll somebody that is your client and moves them away from you if you don't take the extra steps to explain what's going to happen with some of these changes. So working with the family and then working with the carrier. One of the things that popped up here was a piece, and this is like Aetna's training board, and you'll see that they have live trainings with regularity. Most of the carriers do, and they also have virtual trainings as well. So it's important to make certain that you not only know the product, but also the tools that a carrier has to make it work for you too. You see that they're active in Texas with Houston, San Antonio, down in the Valley, Austin. So you got them all over there for different training pieces that come to you. These are the pieces that will identify income for MSP and LIS. It's in the presentation as well, in a different format, however. So it's important that we also make certain that these carriers can help us with all of the innovative material that they have. They have different pre-approved marketing pieces that they can offer to you. In many cases, with a written work plan, they can also help you with different co-ops, sharing expenses for marketing in a particular area. And it's also important to be aware of the information that's available to you on Medicare.gov for these programs. So when you look at the plans, particularly on Medicare Plan Finder, it doesn't always give you all the details on some of the extras that you get with it. It's important that you check those benefits because in many circumstances, that might be the hot button for you to enroll a person onto the program. It's also very, very important, as I mentioned, to make certain that you check providers, all providers that are part of the network. Because if they're accessing their coverage or a service through Medicare, that may well change with an enrollment in a Medicare Advantage program. It's also important to note the availability of carrier support. There's a ton of new material coming out. Some of these carriers are really, really inventive on how we can reach out to people and then avoid the old phone commercial, reach out and touch somebody. We're still socially distant. We're still doing our job, but we are doing it in a fashion that helps with the enrollment process overall, but also helps that individual to stay on board as your client. Having a agent manager with a carrier can really help in that regard because the vast majority of them have been in a car wondering, where can I find this apartment at this time of night when I can't see the numbers? All the lovely things you get with some night appointments sometimes. They realize what you're going through and are a great help to you. And if they are a carrier that offers a retail program, that's the person who's going to get you a store too. Just had to throw that in there. So some different things that can come about because of the support you get and how that varies from carrier to carrier. You got a ton of information available on the internet on how you find these programs. And then, of course, this is the piece that I was referring to, pardon me, where you can get information from the government within certain quantities, printed out pamphlets, calendars, and sent to you without cost. There are programs in there that you can buy if you want, but there's a lot of nice things in there where you can get some marketing material or some things from the government to help you in your business. We offer that same sort of assistance when it comes to electronic programs to help you enroll individuals, cross-sell across the board as well, and our online programs that also help you collect the scope of appointment. The previous software does. This does as well. That not only helps you collect that software, but also store it for that 10-year period as well. It's all part of this. They can also work for you as not only that remote enrollment piece, as we've done and demonstrated in many trainings in the past, but it also gives you the opportunity then to use this as a CRM and work across the board and visit with people year on year of saying, hey, there's an assistance program for people on medications. You want to put out in an application to see if you qualify. That may well help you enroll someone who didn't enroll with you in the fall, but is in your book of business because they were one of the people you tried to sell as well. So it's important to remember, you don't put all your eggs in one basket. Not everyone wears the same size as shoe, and we've got to walk the walk, because all the challenges that some of the software programs offered by the government last year really increased our value in the eyes of our customers as well, and knowing those multiple products can help us grow our business, be it with folks in the dual space who may be able to give us great referrals and we're not able to practice as efficiently with other types of programs, but it also gives us the opportunity to visit with folks with help that's needed in certain areas of their protection. So pop in for our cancer, heart attack, stroke programs that we're going to talk about next week as well. Some of the other things you'll get from us, being able to qualify and certify and basically contract with carriers is where you start in this world. Having this program, Assurance Bay, allows you to add in your material so you know where your E&O is, you know where your licenses are, and you can then answer the questions you're going to find on the majority of any type of contracting application, and it will autofill for you many of the other carriers in the future. So it makes your life easier when it comes to fulfilling your contracting needs. This program helps you with your E&O coverage because it is a program that you purchase and it's yours regardless of who you contract with. So having multiple products with multiple organizations is in some cases a good idea. In some cases it's a challenge if you can't get E&O coverage. This program helps you do that. We also help you maintain your Medicare, or pardon me, Freudian slip there, your personal insurance licensing as well with discounted continuing education programs through our relationship with WebCE. We also help you with your own benefit package where you can qualify for a modified guarantee issued DI program. That's a discounted price where you share in the commission, and it is yours on a standalone basis. A great way for you to add coverage for your own programs. As I mentioned when we started, today's presentation is being recorded, and it, along with much of the detail that created the presentation, with some of those numbers that blew through too fast for you to write down, there's a reason for that. We're going to send it to you. We also send a link to our past presentations that have been recorded for you to go in there and peruse and see what else might be helpful for you. We have another program we're rolling out in a revamped fashion in a month or two also that discusses on how you market a community specifically for dual special needs programs. We've done some of that in the past. You can find the recording on our Premier SMI website or also on our YouTube program as well. Can't wait for the new one. As I mentioned, those different online enrollment programs will help you across the board. We've seen a ton of different carriers become very inventive on how to enroll dual special needs folks over these last 6, 7, 8 weeks. Amazing how, what is that? Desperation is the inspiration for, I don't know, whatever it is. They're doing good. We also have different programs that can help you determine your full compensation for programs. Dual special needs plans, obviously, as part of the MAPD world, doesn't allow for any type of incentive programs because of the government knowing better on how agents should be paid. Sarcasm. But this is a good place to go and find out where you might be in qualifying for different organizations. Our trip this year was to be a cruise from the Bahamas from Miami to the Bahamas. That changed quite a bit, obviously, but we still offer different types of lead support programs. Contact lead lists are available to you. Different community-based programs, specifically programs within that genre to help you be effective in retail marketing. Don't just go sit at Walmart and let's make it work for you. Different programs that can help you do that. Same way with working with faith-based organizations. We're the people that deliver the care that we sell as part of our insurance products. So that includes not only doctors and pharmacists and specialists, but also dentists. Some different folks in the community that can help us be successful. Many times a carrier offering a Medicare Advantage program will have different lead programs available for you there as well. That's an important reason to, once again, be very aware of and part of the marketing program of your carrier's agent manager in that area as well, is because they control those leads. We have also began offering a Facebook lead program in final expense and the Medicare world, and we do offer direct mail support as well, deeply discounted prices driven by production with our current agents. All that said and done, knowing some of the specifics that are necessary for you to be active in this space can be part of a challenge for you. And there's a lot of, okay, give me the nitty-gritty as to why this plan here looks so bloody good, but they're not writing any business. We're not writing much business. What's part of the rationale for that? So it's a very important piece of your marketing schedule. This can be, but it's a very important piece for us then to be very active in asking you for your business, but then helping you plan for it. Because the good stuff comes with a lot of work with it as well. So if we decide mutually that this is something we want to go forward with, we want to make certain that you are contracted and licensed for the programs that are best for you in your area, and that then would require a little deeper dive into some of the programs that are available for you in your market than what I did here today. We need to be conscious of the program and study for it and make our local contacts aware of the fact that we are looking to professionally present these programs and make certain that they help us with marketing support in our areas. All that said, you can find out more about dual special needs plans at our toll-free number at 1-800-365-8208 or also through our website at premiersmi.com. So, all that said and done, we want to thank you for the time that you spent with us here today. We appreciate the investment of that time with us, and we look forward to speaking with you again in the very near future. Thanks so much. Talk to you soon.